So vitamin A, very important. Now, conventional medicine typically will use tretinoin or Accutane. So you have Retin-A, which is your topical tretinoin, and then you have your Accutane, which is your tretinoin. Usually you're going to start at 10 to 20 milligrams. So usually about 10 milligrams, I want to say it's usually about 10 to 20 times stronger than your retinol. And of course, conventional medicine likes to make sure it's patentable because one, it's more potent, two, more side effects, but three, they can patent it. They can make more money. There's not a lot of money to be made on a $20 bottle of retinol that may last you a couple months, right? And also, when we even use vitamin A, we like to always go to whole food sources first. We always like to go to cod liver oil. We like to go to organ meat, especially liver. Very high natural vitamin A there. Egg yolks, great sources. And then some people, we may have to go into oral high dose retinol. Now, again, any conventional doctor will tell you this, but if you're a female listening, you have to make sure that you are not trying to get pregnant while on a high dose retinol, that you get your levels tested, maybe even also get your liver enzymes looked at, ALT, AST. And 3 months after using high dose retinol, you need to make sure that you are also abstaining from intimacy where you would not get pregnant there, because there's high chance of teratogenicity, if you will, birth defects. Not saying you would have that on a high dose on a retinol, lower dose, you'd probably be okay. But still, I always just say, nope, no retinol, no pregnancy. And then make sure 3 months afterwards, you are aware of that. Now with patients, we will engage in higher dose retinol therapy, again, which is still 20 times less than Accutane. So Accutane has some side effects. So like a 10 milligram dose of tretinoin is about 10 which is a low dose. Usually the dose is between 10 to 60 milligrams, and it's mostly at 60. 10 milligrams will be around 3 to 600,000 IUs of retinol. All right, just dosage wise. It's about a 10 to 20x difference. So about 3 to 600,000. And then when you go up to a 60 milligram, that's somewhere between 2 and 4 million IU. And so a patient, sometimes we'll start patients on 50,000 and we'll go up to a couple 100,000. There's some scientific studies in the last 5 or 10 years, meta-analyses actually supporting that. But high-dose vitamin A therapy, when we deal with the skin, is always the last thing we do. So many patients' skin issues, you don't need high-dose vitamin A.